Hi, Patricia here from Rapid NCLEX. Today we are breaking down myocardial infarction, the signs and symptoms, the treatment, and the nursing care that you need to know for every exam when every second counts. With myocardial infarction, the heart muscles die due to the sudden blockage of blood flow to the heart. And for the pathophysiology, when a patient has atherosclerosis, it is going to cause the build-up of plaque, which we have described earlier. So when this plaque ruptures, it is going to form a thrombus, and this thrombus can occlude blood flow to the heart. So some of the signs and symptoms, patient is going to have chest pain, shortness of breath, dizziness, diaphoresis, nausea and vomiting, fatigue. Take note of the characteristic of the pain. So the pain can radiate to the back, the shoulders, and the jaw. And NCLEX is going to describe the pain as crushing pain, squeezing pain, and heaviness in the chest. Now take note to the specifics. What makes you a good nurse is for you to know the specific associated to every condition. With patients like diabetic patients and women, they do not have the typical symptoms that we have described above. So with diabetic patients, they are going to get the atypical symptoms, which means that they are not going to get the pain that we have described because they have something called neuropathy, and due to their neuropathy, they are not going to have those symptoms that we have described. So women and diabetic patients, we should be monitoring for these atypical symptoms. And to the diagnosis, our key marker here is troponin, which we have described in our previous video. Take note that when a patient gets an attack, the troponin levels are going to stay in the blood from 3 hours to up to about 7 to 10 days after the attack. So even if the patient does not return to the hospital immediately after the attack, after 7 to 10 days, we can still detect level of troponin within the blood. CKMB can also be tested, but the key marker here for myocardial infarction is troponin. Also, EKG levels are going to be taken. And take note, I stated earlier that any condition relating to the heart, we are going to do our ECG monitoring. So on ECG monitoring, some of the changes we are going to see an ST segment elevation. Ever heard of the STEMI or ST segment elevation myocardial infarction? Yes, we are going to see an ST segment elevation, which may indicate no oxygen flow. And then we are also going to have a non-ST segment elevation or an abnormal Q wave inversion, which may also indicate a low oxygen flow to the heart. Usually, this ST segment abnormalities return to normal after reperfusion. Another diagnostic method is cardiac catheterization, which can also be done. So for our medical management, we can give the patient aspirin, clopidogrel, anticoagulant, AC inhibitors. And take note, for myocardial infarction, we were using MONA as the famous management in acute MI. Take note, the MONA, which is morphine, oxygen, nitroglycerin, and aspirin. But the new updated NCSB and NGN style says that we should use the acronym ONAM in managing acute MI. So for the ONAM, we will give oxygen first, we will give our nitroglycerin, we will give aspirin, and then our morphine. So some risk factors to myocardial infarction. Our number one risk factor here is going to be atherosclerosis. And then we can have coronary artery diseases, elevated cholesterol levels, smoking, hypertension, obesity, physical inactivity, and impaired glucose tolerance. And then stress are all risk factors to getting myocardial infarction. So for our nursing management, we are now going to assess the pain, especially the characteristic of the pain. So this substernal crushing pain that's radiate to the jaw, the back, and the left arm, the dyspnea, the nausea and vomiting, diaphoresis, all these things are what we are going to assess for in the patient. But take note of this for your NCLEX exam, that in myocardial infarction, pain relief increases oxygen supply to the myocardium. That is our primary goal here. So we'll have to administer our morphine as a priority in managing pain in the client with myocardial infarction. So for our nursing management, we'll administer oxygen using our ONAM, and then we'll also administer our nitroglycerin as prescribed. All medications as prescribed will be administered. We'll assess patients' vital signs, especially their cardiovascular status, and then we'll continue the cardiac monitoring. Our ECG here is very key. So we'll obtain a 12-lead ECG, and then we'll monitor for any abnormalities that occur on our ECG. We are also going to monitor our patients for signs of cardiogenic shock. So some of the signs for cardiogenic shock will have hypotension, tachycardia, tachypnea, and a weak pulse. And then we are also going to focus on cardiac rehabilitation exercises for the patient. Alright, that is all for now, and see you in our next video.